Hi, this is Dale Stringer with First Medicare Advisors. Welcome back to our videos on Medicare updates. We're going to be talking today about what you don't know about Medicare and what it can cost you. Now, as you recall, Medicare provides critical care benefits to you when you reach age 65. However, how much do you really know about the program? Did you know, for example, that it's not totally free when we're talking about Parts B and D? Now, true, most retirees don't pay a premium for Medicare Part A, which covers hospital visits, but Parts B and D, which cover outpatient care and prescription drugs, will have a cost to you. Now, the standard premium for Medicare Part B is currently $134, though it may be higher depending upon your income. Now, your Part D prescription drug cost will depend upon your earnings. If you exceed a certain threshold, you'll be subject to an increase on top of your regular Part D premium. Next, enrolling late in Parts B and D could also cost you, since you can't use Medicare services until you turn age 65. You can and should enroll up to 3 months before the month of your 65th birthday. Now, signing up for Medicare on time is a good way to keep your premium cost to a minimum. Now, your initial enrollment period is effective for 7 months, beginning 3 months before the month you turn 65 and ending 3 months after you turn 65. Miss that window, however, and you could see your Part B premiums rise 10% for every year you go without coverage upon becoming eligible. Now, being late to enroll in Part D could also cost you. If you go 63 days or more without a prescription drug plan, you could face a late enrollment penalty that's equal to 1% of the national base beneficiary premium, which presently is $35.63, times the number of full months that you failed to obtain coverage. Let's say you go 24 months without coverage, for example. That will add an additional $8.55 a month to your cost. Now, also, Medicare has gaps in coverage. Now, Medicare is an acute care type of coverage. In general, Medicare will have deductibles for in-hospital care and also deductibles and co-payments for outpatient services. Overall, Medicare pays about 80% of approved Medicare coverage. There is not an upper limit on that 80% either. What you should do is purchase a Medicare supplement plan from a private insurance company to cover the expenses not covered by Medicare. Now, if you have any questions or need more details about what we've discussed so far, there's 3 ways that you can get in touch with us. Now, also, as you always know, please don't worry about a sales pitch. We hate them as much as you do. First way you can contact me is send me an email to info@firstmedicareadvisors.com and ask your question. Secondly, you can call our recorded hotline at 1-800-958-8171 and leave your message. Please leave us your first name and then ask your question. But for quicker responses, what you can do is you can call our telephone directly at 1-800-825-2919 for free, complimentary, unbiased answers. Now, moving along, with Medicare, it does not cover long-term care. You might eventually end up needing assistance with daily living tasks. But if you're counting on Medicare to pick up the cost, guess what? It won't. Medicare will cover your acute care needs. It will not cover your long-term care expenses like home health aides that aren't medically necessary. You consider purchasing a long-term care insurance policy, or at least saving possibly enough to cover what could be some significant out-of-pocket costs. Also, Medicare doesn't provide coverage outside the United States. When you retire, you will probably be thinking about doing some traveling. Now, if you're going outside the continental United States, you'll need to arrange for additional health coverage. If you don't, and you get sick or injured abroad, Medicare won't cover you. It could be quite costly if you get sick once you leave the country. Now, you can also receive Medicare services from the comfort of your own home. Now, getting to and from medical appointments might become difficult for you as you get older. There's a program called Medicare Telehealth Services. It offers you access to medical advice without you having to leave home. Now, you can find the program by Googling Medicare Healthcare Services for the details. I would put the link on the video here, but it's about a mile long and I couldn't get it on here without covering everything up. But you can Google it easy. Now you can consult with a ton of different providers electronically to get the answers to your health questions. It could save you both time and money. Now in closing, the more you know about Medicare, the more you'll be able to maximize your benefits. Now when you're turning 65, it still pays to read up on Medicare and find out what it does and does not cover and how it works. Remember, if you have any questions or need more details, there's 3 ways to contact us. Please don't worry about the sales pitch. We hate them as much as you do. You'll get the information that you need to make good decisions on this important area of your life. You can call me and leave an anonymous email to info@firstmedicareadvisors.com and then ask your question. You can also call our recorded hotline at 1-800-958-8171 and leave your message. Please leave us your first name and then ask your question. And finally, for a quicker response, you can also call our office direct at 1-800-825-2919 for complimentary, unbiased answers. Finally, thank you for watching our video. It's greatly appreciated. And call us if you have any questions or wanted any additional information. We're here to help you.